Tips on how to overcome diabetes through diet and exercise. What diet? What exercise? Let's find out. Introduction. Are you or someone you know struggling with diabetes? It's no secret that managing this condition can be a challenge, but there is hope. With the right diet and exercise routine, it is possible to overcome diabetes and live a healthier life. In this blog post, we will explore the best tips for managing diabetes through diet and exercise. From understanding the link between food and blood sugar levels to discovering effective workouts for improving insulin sensitivity, we've got you covered. So let's dive in and start taking control of your health. What is diabetes? Diabetes is a chronic disease characterized by high levels of glucose, sugar, in the blood. This happens when the body either doesn't produce enough insulin or cannot use it effectively. There are three main types of diabetes: type 1, type 2, and gestational. Type 1 diabetes is an autoimmune disease where the body attacks and destroys its own insulin-producing cells. Type 2 diabetes occurs when the body becomes resistant to insulin or doesn't produce enough of it. Gestational diabetes can occur during pregnancy and usually resolves after childbirth. The symptoms of diabetes include increased thirst, frequent urination, blurred vision, fatigue, slow healing wounds and infections, and unexplained weight loss. If left untreated or poorly managed, diabetes can lead to serious health complications such as heart disease, stroke, kidney damage, nerve damage, and blindness. Therefore, it's crucial for those with diabetes to manage their blood sugar levels through lifestyle changes including diet modifications and regular exercise. Types of diabetes. There are three types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disease where the body's immune system attacks and destroys the insulin-producing cells in the pancreas. This results in a lack of insulin production, which leads to high blood sugar levels. Type 2 diabetes occurs when the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. It is often caused by lifestyle factors such as poor diet and lack of exercise. Gestational diabetes occurs during pregnancy and usually goes away after delivery. However, women who have had gestational diabetes are at a higher risk for developing type 2 diabetes later in life. Each type of diabetes requires different treatment approaches based on individual needs. It's important to work with a healthcare provider to determine the best course of action for managing your specific form of diabetes. Causes of diabetes. The causes of diabetes are varied and complex. While there is no single cause for the disease, there are several risk factors that increase a person's chances of developing it. One major contributing factor is genetics. A family history of diabetes can significantly increase your risk of developing the disease. Additionally, certain ethnic groups such as African Americans, Hispanic, Latino Americans, Native Americans, and Asian Americans are more likely to develop diabetes than others. Lifestyle factors also play a significant role in the development of diabetes. Being overweight or obese can lead to insulin resistance, which increases your chances of developing type 2 diabetes. Inactivity and a sedentary lifestyle also contribute to this increased risk. Other medical conditions such as high blood pressure, high cholesterol levels, and polycystic ovary syndrome, PCOS, have been linked to an increased likelihood of developing diabetes. Environmental factors such as exposure to toxins or viruses may also contribute to the development of this disease. While there is no one definitive cause for diabetes, understanding these various risk factors can help individuals take preventative measures towards reducing their likelihood of developing this disease. The link between diet and diabetes. Diabetes is a chronic health condition characterized by high blood sugar levels. While genetics and lifestyle factors such as lack of physical activity play a role in its development, diet also plays a significant role in the onset and management of diabetes. One of the main links between diet and diabetes is carbohydrates. Carbohydrates are broken down into glucose during digestion, which raises blood sugar levels. Therefore, people with diabetes need to monitor their carbohydrate intake closely to keep their blood sugar levels within target range. Another important factor is fiber intake. Fiber helps slow down the absorption of glucose into the bloodstream and can help improve glycemic control for people with type 2 diabetes. In addition, consuming excess calories from any source, whether it be carbohydrates, protein, or fat, can contribute to weight gain and insulin resistance, making it more difficult to manage blood sugar levels. There is a clear link between diet and diabetes that should not be overlooked. By making conscious decisions about what we eat on a daily basis, we can significantly impact our risk for developing this disease as well as our ability to manage it effectively if already diagnosed. The best diet to overcome diabetes. A proper diet can play a crucial role in managing diabetes. The primary goal is to keep your blood sugar levels stable and within the target range. So, what should you eat? Firstly, try to avoid processed foods that are high in sugars and refined carbs. Instead, opt for whole foods like fruits, vegetables, lean proteins such as chicken or fish, and healthy fats like avocado or nuts. Carbohydrates are not necessarily bad for people with diabetes but should be eaten in moderation. Choose complex carbohydrates such as whole grains instead of simple ones found in sugary drinks and snacks. It's also important to pay attention to portion sizes when eating meals. Eating smaller portions more frequently throughout the day rather than larger meals can help regulate blood glucose levels. Incorporating fiber-rich foods into your diet is essential for managing diabetes since it slows down digestion and helps control blood sugar spikes after meals. Consulting with a registered dietitian who specializes in diabetes management can be helpful if you're unsure about what types of food would work best for you. The importance of exercise in overcoming diabetes. Exercise is an important component in managing diabetes. Regular physical activity helps to lower blood sugar levels and improve insulin sensitivity, thus reducing the risk of complications associated with diabetes. Exercise also helps to maintain a healthy body weight, which is important for people with type 2 diabetes. There are many types of exercises that can be incorporated into a diabetes management plan. Aerobic exercise such as walking, jogging, or cycling can help to increase heart rate and oxygen flow throughout the body. Resistance training such as lifting weights or using resistance bands helps to build muscle strength and improve flexibility. It's essential for those with diabetes to consult their doctor before starting any new exercise regimen. Medical professionals will work with individuals on creating an exercise routine that suits their lifestyle and health needs while avoiding any activities that may cause harm. Exercising regularly doesn't have to mean going to the gym every day. It could be something as simple as taking a walk after dinner each evening or doing yoga at home. Any form of regular physical activity can make a difference in managing diabetes effectively. Incorporating regular exercise into your daily routine along with proper nutrition is key in overcoming diabetes naturally without relying solely on medication. It's vital for those living with this condition not only to take control over what they eat but also how much they move, even if it just means taking small steps towards building healthier habits one day at a time. The best exercises to overcome diabetes. Regular exercise is crucial in managing diabetes as it helps to improve blood sugar control, increase insulin sensitivity, and prevent complications associated with the disease. However, not all exercises are created equal when it comes to combating diabetes. Aerobic exercises such as brisk walking, cycling, and swimming can help lower blood glucose levels by increasing the body's ability to use insulin. Studies have shown that regular aerobic exercise can reduce HbA1c levels by up to 0.7%. Strength training exercises such as weightlifting or resistance bands can also be beneficial for people with diabetes. They help build muscle mass, which aids in burning calories more efficiently and reducing insulin resistance. Flexibility exercises like yoga or Pilates promote relaxation and stress reduction, which can help regulate blood sugar levels. Additionally, they assist in improving balance and coordination, which reduces the risk of falls, an important consideration for older adults with diabetes. It's recommended that individuals engage in at least 150 minutes of moderate-intensity aerobic activity per week along with 2 sessions of strength training per week. Flexibility exercises should be incorporated into your routine on a daily basis. As always, consult your healthcare provider before starting any new exercise regimen, especially if you have pre-existing health conditions or other concerns about exercising safely while living with diabetes. Conclusion. Diabetes is a condition that can be managed and even overcome with the right diet and exercise routine. It's important to understand the link between what you eat and how it affects your blood sugar levels, as well as incorporating physical activity into your daily routine. The best diet for overcoming diabetes is one that focuses on whole foods such as fruits, vegetables, lean proteins, healthy fats, and complex carbohydrates. Avoiding processed foods and sugary beverages can also go a long way in managing blood sugar levels. When it comes to exercise, finding an activity you enjoy and doing it regularly can help improve insulin sensitivity and overall health. Activities such as walking, cycling, or swimming are great options for those just starting out. Remember to always consult with your healthcare provider before making any significant changes to your diet or exercise routine. With commitment and dedication towards creating healthier habits, living with diabetes doesn't have to feel like a burden but rather an opportunity for better overall health.